Hello, everyone. This is Shreyan, the founder of MEWE, and this is the very first episode of MEWE's podcast. So glad you could join us. Today on the call, we have Dr. Krithika Iyer, who is a psychiatrist. So, hello, Dr. Iyer. How are you doing today?
Hi, Shreyan. I'm doing good, and thank you for having me here on your podcast.
No problem. Thank you so much for joining. So I know that in society general, there's a kind of confusion between like what's the difference between a therapist, psychologist, and a psychiatrist. So can you tell me more about your role as a psychiatrist and how it's different from being, say, like a therapist or a psychologist?
Yeah, sure. That's a very important question, Shreyan, because in the society we have many different kinds of professionals who can help children, adults, elderly with various mental health issues. But there's definitely a lot of confusion about who does what. Okay, so I want to categorize uh, in the professionals in two categories. First of all, the ones that provide counseling services, and the other that provide more medication management services. And actually, there is a third category also, which is not a category, but psychiatrists who do both sometimes, both medicine and therapy. So, so in simple terms, a therapist or a counselor is someone who can provide guidance, support, or counseling to people who are in need, who suffer from depression, anxiety, or other ailments. The way the therapists differ is that they differ in terms of their qualifications. So, for example, therapists can be a licensed mental health counselor or a licensed clinical social worker or a clinical psychologist or a doctorate having a PhD in psychology. Um, Now, that's the therapy side. So, when it comes to someone who needs medication, that is something that comes from a psychiatrist or an advanced psychiatric nurse practitioner. Now, you can also have like family doctors, pediatricians, neurologists do prescriptions or medications, but psychiatrists are definitely a little bit more well equipped to treat mental health conditions. So, oftentimes in the community, Shreyan, what I see is there's a lot of misunderstanding between what a psychologist does, what a psychiatrist does,
Mhm.
what is the kind of therapist one might need. And it is there is a lot of confusion, and oftentimes it's very overwhelming for the patients in the community, and that itself is actually sometimes it creates a lot of barrier to even access help because they do not know who to see.
Well, yeah, I definitely agree. And thank you for illuminating more on like the differences. And I think that was like overall really helpful. So, given that you're a psychiatrist and your roles, what are some misconceptions that you see in like the field of psychiatry regarding mental health?
Right. So I feel that in psychiatry as well as in psychology, there's a huge amount of stigma associated with seeking help or treatment for any form of mental illness, whether it's a mild form or moderate or a more severe form. Um, People are often scared or worried to get help as they feel that their confidentiality or privacy will be compromised oftentimes. They're also worried about feeling rejected by their peers, for example, or coworkers if they find out if they what if they find out if they're getting mental health help, does that mean there's something wrong with them, or that they're not going to be acting right. And so there's a lot of fear about having a mental health problem, so to speak. And So the first misconception is basically a lot of stigma associated in wanting to or having to or needing to see a professional. The secondly, it's the more of the community perception that I feel. So oftentimes, one of the myths is that people in the community will think patients with mental illness are often crazy. So is that true? I mean, not really, right? Because
Mhm.
how do you define crazy then?
Yeah.
Crazy could have so many different levels on the spectrum. So automatically, you don't want to assume when someone's dealing with an anxiety issue, depression issue, or even a
Mhm.
bigger issue like an addiction issue that they're automatically crazy.
Mhm.
So that's another I notice. So and then also additionally, there is this perception that patients who have mental illness cannot function in the society.
Mhm.
Okay. So I feel like that is a very huge burden and a very huge factor in that plays a role in you know not being able to integrate some of the people who have these issues into the society. Um, in a way, often patients with depression, anxiety, bipolar, schizophrenia, they're looked upon as they're different, or they've got problems, or
Mhm.
they're incapable, or um, they are disabled, so they're not able to function. So they are deprived of like opportunities as a result, because they're kind of alienated from the mainstream society.
Yeah. And
So these
actually,
are the yeah
oh,
yeah
go ahead. Sorry.
no, that was it.
Oh, okay. Yeah.
Yeah.
I just wanted to say, and that's exactly what we try to like recognize and do at MEWE. Like we see stigma all across like society, and that's like the number one reason why maybe like youth are afraid to maybe get mental health resources and help because they feel that their friends might ostracize them, that they might not be part of their friend group. So that's like the job of a psychiatrist as well, right? To like normalize mental health treatment and make sure that it's open to everybody. So thank you for that. That was really helpful. And so now you mentioned about like stigma and then people of the community and members of the community creating these sense of stigma and this fear. So since we're the ones who are technically like creating it, how can we also like break the stigma?
Okay, so yeah, that's the million dollar question, Shreyan, right? How do
Mm-hmm.
you break the stigma associated with mental illness, not only suffering from it? How do you break the stigma of getting treatment? How do you break the stigma of someone who is in recovery? How do you break the stigma for family members who have their loved ones um,
Exactly. Mm-hmm.
getting treatment for their family members? So the stigma occurs at all levels, not just the family level, but also at the community and the political level. And with where you have like the legislatures associated with funding for mental health and creating awareness and making laws. So how do you break the stigma? There is no one answer to it, but there are many explanations, okay? Because in order to intervene on this huge issue, I mean, you have to like address issues and stigma at the various levels. And it primarily comes with like education and advocacy, right? So, how do you educate the community, the people, like the lay people in the community? How do you raise awareness in the community about mental health issues? And one of the things I I feel is being implemented, which is really good, is you have all these various programs in the community, like they have support groups, not walks,
Mhm.
marathons, and different things, to create awareness. So that is one way of raising awareness.
Mhm.
um, Another way of awareness is, now we have social media, so a lot of awareness is done on Instagram or Facebook or Twitter, in talking about issues or being open about issues. And I think that the important thing one can do is being outspoken and helping someone who is in need and speaking for someone who is suffering or who could benefit. Talking about, like, the implicit and the explicit bias that goes on in how some of the mentally ill people are navigating through their challenges. So being outspoken, helping someone who is in need, and showing and taking action, in being open about it. And like, I remember Mahatma Gandhi's saying, who said that if you should be the one to make a change,
Mhm.
so do not wait for other people to make a change. You can be the one to start making the change. So even if it starts with one person, and then it creates awareness, and it helps the community overall. So, like I said, there is no one answer for stigma, but stigma is something. Um, it's almost like a racial discrimination in a way. How do you
Mhm.
break it? You basically create awareness. You educate people on the facts, and not and remove the myths associated.
Yeah, that sounds great. Yeah, we're trying to do that maybe with like, bringing in professionals like you. So hopefully we're on that way towards breaking stigma. So, as a psychiatrist, what are like some signs that a person what are some signs that you see in a person with mental health challenges that when you see those signs, you're like, oh, they might need like mental health? Like, what are the signs usually?
Okay, so it depends on what is the condition you're talking about, right? So,
Hmm.
for example, in the field of medicine, you have someone who has diabetes will have high blood sugar, or
Hmm.
hypertension, high blood pressure. um, so in mental health, what happens is, the unfortunate part is, that you don't always see it coming, correct?
Hmm.
Oftentimes, it's very abstract. You feel the problem. The person who is suffering might feel the problem, but they don't necessarily know what that means, or whether
Hmm.
it is abnormal, or are they different. Oftentimes, family members do not see. Parents may be very oblivious or unaware of what's going on with their child. Um,
Hmm.
Also, for example, in school, um, teachers may be very unaware of what the child is going through. The school
Hmm.
and teachers, they're basically imposing the expectations on the child academically to advance and whatnot, but they're really not able to fully comprehend what the child's needs are. And oftentimes, children who have like learning disabilities or other issues, ADHD, they can have
Hmm.
major issues at school as a result. So, so like I said, the symptoms can be very different. So, for example, if you look at depression in a teenager, oftentimes
Hmm.
the teenager who is suffering will not say, "Hey, mom, I'm depressed, I'm sad." They will not
Yeah.
say that, but rather, what might happen is they might start isolating themselves. They may lose
Hmm.
interest in their hobbies, or the extracurricular activities, or they may they may act out, which is a very common problem. So
Hmm.
parents are often noticing that the child is angry or aggressive or irritable, and they act out. So the parents are seeing like the outward problems, the externalizing problems, but they're really not
Mm-hmm.
fully aware of what is going on internally in the child's mind.
Mm-hmm.
um, so those are some signs you could see in a child who is depressed. Now, there's another problem, which is like a generalized anxiety disorder
Mm-hmm.
or social anxiety disorder, where the child is very, very anxious. They're always on the edge. They worry a lot. You
Mm-hmm.
know, anxious child might ask a lot of questions, or they may actually shut down. If something is making them anxious, they might just shut down. And anxiety can lead to depression. And then I feel like another major problem we should talk about is substance abuse, right? Uh,
Mm-hmm.
drug drug abuse
Definitely.
in teenagers, because what ends up happening is a lot of times, if teenagers are not able to get help or feel better, they often
Mm-hmm.
turn to illegal substances or even legal substances: alcohol, vaping, cigarettes, medical marijuana, which is legal in the state, but it is not clinically appropriate to use in to
Mm-hmm.
treat health issues. But what we are seeing is that children are young teenagers are as early as 13, 14. They're often abusing substances because of peer pressure, or in a way to self medicate their symptoms. And if parents, one of the advice I would give parents is that, if they see that the child is, for example, clouded in their consciousness state, like they
Mm-hmm.
look like they're in a fog, or their eyes are red, or they seem jittery, or they're not sleeping, and they're acting kind of erratic, definitely consider substance abuse, and take them for evaluation and treatment. And of course there are other bigger problems, Shreyan, which
Mm-hmm.
we won't be able to talk about in this short time, but we have a various list of conditions and disorders that we often encounter in young teenagers, young adults, which impacts them in their academic years, in their early professional years. And it's always good to recognize those signs and symptoms, so they can successfully complete high school, college, and establish a job or a career for themselves, despite having these issues.
Yep. Yeah, and definitely. And I think it's like really unfortunate to see these young children and youth and adolescents like fall into the trap of like mental illness and succumb to it. So, yeah, that's why overall I think it's really important to really focus on, again, getting rid of the stigmas. That way, not only can they get the help that they receive, but also in general they overall can improve their mental well-being. So thank you for that. So now you mentioned like I know you mentioned stuff like parents being able to see like specific signs or to look out for specific signs. So that's actually one of my next questions. So could you maybe elaborate a bit more on what like a parent could do if they do see those signs in their child, or maybe like if their child is dealing with mental health challenges, what a parent can generally do?
Excellent question, because this is something what I, as a child psychiatrist, often encounter in my day-to-day practice. As and it comes down to whether parents, first of all, have the knowledge or the
Mm-hmm.
understanding, uh, comprehending what is going on with their child. So one of the things I advise parents is that believe in your child, have faith and listen to what they're saying. Okay, because when children are saying something, it has a meaning. It is not something you can ignore. um, and be a good listener. Okay, that's number one. Because oftentimes, Rayan, just having someone to talk to actually can make a huge difference for people who are going through certain issues.
Definitely.
Just knowing that, okay, I have my mom who is there for me that I can talk to, or I have my sister or whatever, cousin, grandparent. So just knowing that someone cares about you and is there for you to lean on sometimes can make a huge difference. So listening is one important skill parents need to develop. Oftentimes, parents are very authoritative, or they have their own set of expectations or rules of the family, and children are often expected to abide by those rules.
Hmm.
It can come across a little bit difficult for children in those situations, because they're afraid to approach their family members or to talk to them about what is going on. I
Hmm.
also encourage parents to have an open line of communication, okay? Using good communication, good tone of voice, clear communication. And For example, children who have anxiety or depression and whatnot, it's very
Hmm.
common, or it's not uncommon for parents to feel frustrated about the situation, and sometimes parents will raise their voice or get upset or
Hmm.
put more pressure, and it leads to increased level of stress in the dynamics of the family. And
Hmm.
as a result, there's a lot of negative expressed emotion that goes on, and that can affect the child. And so educating parents on how to keep themselves calm when their
Hmm.
child problem, and how to establish a sense of normalcy or a consistency, or a routine and a good structure to the best of their ability is very important for parents to implement. I also educate parents on, being like a person, like a first line of defense. So, for example, for
Hmm.
children, usually, in terms of learning, education, oftentimes parents are the first line of defense. Okay, so
Hmm.
uh, their parents are their first teachers, and parents are their first counselors. And in some families where, let's say, the parents are absent for whatever reason, usually there is another caregiver, a grandparent, or an
Hmm.
uncle, or aunt, or a foster parent that is available. So they need to validate the child's feelings. Okay, they need to acknowledge the child's feelings, and they need to be able to talk to them about it in a non-biased way, and get them professional help. Parents have to be definitely open-minded about what they're thinking, because you don't want to assume anything. For
Hmm.
example, some parents might misunderstand, or they might you know catastrophize, so to speak. Like, they might just think of the worst possible scenario when their child opens up about a certain problem.
Hmm.
What they need to understand, Shreyan, is that just because somebody has a certain problem that they are talking, it does not mean it's the worst thing in the world. They could just be
Hmm.
they could be just having a bad day. They just need a shoulder to lean on. So parents need not necessarily go from 0 to 100 when they hear or see or encounter a certain issue in their child. Yeah.
Yep, I definitely think the same that support is key. In fact, when I saw like one of my friends who's suffering through mental health challenges, their family was kind of absent because their family had another set of challenges. So I saw that she was able to get help and support through other ways. But I definitely agree with you that support and family just supporting you overall will really help. So now that we have family support, once that family does give support to like the child and the adolescent, let's say, what are some resources that the family or the child can reach out to so that way they'll be able to treat themselves and get better?
Right. So your question is, how does one target treatment, or how does one initiate treatment when once you have found there is a concern?
Hmm.
Um, so this is where you need help of a professional, and the professional can begin from the clinician being just a pediatrician to start off. Okay.
Hmm.
Sometimes, like, children have their family doctors or pediatricians who will evaluate them, or who they can approach easily and who they often trust. Um,
Hmm.
and the pediatrician can make a referral to a counselor or a psychiatrist or
Hmm.
another specialist. um, so that's the easy part. The other part is, once you have a referral, or once you have identified who you want to see, um, how do you confirm there is a problem? Okay, so oftentimes what happens is, there is not a major problem. The problem might be just a temporary issue or a phase of life issue.
Hmm.
But in order to clarify that, you might need the help of a professional to ensure that that is the case. So you're not missing anything. Um, I think the best answer, Shreyan, is who you are able to access at that point in time, depending upon the availability, access to care, you know, and like distance from where you are located. For example, there are some families who are unable to drive them to a therapist.
Hmm.
So could they utilize like an online therapist for just for a clarification? One of the main interventions one could do, or one of the main resources a child could have, is someone they can call in a state of emergency or urgency.
Hmm.
Okay, so what happens is, a lot of times I notice that students will email their friends in a group chat about how they are feeling.
Hmm.
Um, they might tell some third person stranger about how they are feeling. Um, Oftentimes, I notice that the students, when they share in a group, their peers are often very helpful and knowledgeable, and they get them the help they need. They either tell
Hmm.
their parents or their teachers, or appropriately the action is taken. But at the same time, I think students should know there is a lifeline called 988.
Hmm.
And that's a lifeline. It's not just for children, it's also for adults and all age groups.
Hmm.
So it has been created since July of 2022, and it is similar to 911 calls, which is more for medical emergencies. But 988 call is more for a mental health emergency, when somebody is
Hmm.
feeling, for example, suicidal or in a state of crisis, and they just want to talk to someone. So this is a lifeline that is well established now, after a year of being in being implemented, and it is well staffed, and there are counselors on the phone who immediately help out and intervene and give suggestions and advice. And I think that is something I would recommend. Additionally, you can see a mental health counselor either online or in person.
Hmm.
You can also see a psychiatrist if you are able to. You can see a psychologist who are a little bit more better qualified, and who actually can provide a lot of therapeutic support and interventions of higher quality. Um,
Hmm.
and At this point, I think there are a lot of available professionals in the community, and the way to access them for family members would be either through through an online approach. For example, there is a website called psychologytoday.com.
Mm-hmm.
And if you go on the website and you put your zip code, you can actually get a list of therapists, psychologists, psychiatrists, counselors in your area with their descriptions of what they practice, what they specialize in, and what their interests are, and how much do they charge, whether they take certain insurances or not. So that is a
Mm-hmm.
very good website I would recommend as well for 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 families and children or patients.
Perfect. Yeah, actually, we have the 988 and Psychology Today and a bunch of other resources on our website. So, for those of you who are listening into this or tuning into this, you should be able to just go to our website, mewe-mentalwellness.org. Just go under resources, and many of the resources that Dr. Iyer mentioned to us are actually on there. So, with that, thank you so much, Dr. Iyer, for being on this podcast. It was really wonderful to have you. And yeah, thank you for spreading the message and teaching us more about mental health.
Yeah, so Shreyan, thank you for giving me the opportunity to be a part of your podcast. You're doing great work, and I wish you the very best in this endeavor.
Thank you. Thank you.